now Dr. Reena Abdul Rasheed is going to talk about the ethical concerns and challenges of using AI in ophthalmic practice. Over to you, ma'am.
So now we heard what all things AI can do to you. So it's whatever its possibilities are immense. Now I will be talking about what AI cannot do, or where you can AI can mislead you. So the key ethical challenges when you in AI, when it is considered, the most important point to remember is that eye is not just a diagnostic organ. Actually, it is an identifier. So, is it important to understand the ethical landscape surrounding AI use in ophthalmology? Yes, it is, because there are so many things still AI cannot use, some of which already Dr. Smitha has explained. But in clinical application, there are so many other things which you should be aware of. So, in this session, we will be talking about what are the key ethical challenges in AI use in ophthalmology, and what are the strategies you can use to minimize them, and how you can integrate AI into your practice in a responsible manner. So whether you use AI or not, in clinical medicine, the medical ethics remains the same. The core principles are autonomy. That means you have to always respect the patient's interest and take a shared decision. And beneficence and non-maleficence means you have to do good to the patient and never do any harm. And justice, whatever you do, the services should be accessible and equally available to everyone. But in clinical ethics, you may have to add privacy and confidentiality, along with honesty in the profession and error reporting as basic ethical guidelines. Now, just for you to think, I am talking about a situation. Just imagine you are a single ophthalmologist in a clinic who is using an AI-equipped machine for glaucoma screening, and the machine reported it as less than 5% chance of glaucoma, and no further evaluations were done. And maybe months or years later, the patient is coming back to you with an advanced field loss. So there are so many ethical questions that are related to this situation. So another scenario, just a tertiary eye care hospital or an institute where thousands of images are getting uploaded into the system every day. And these whatever pictures are uploaded, they can be used in other intermediate cloud-based AI for their validation and updation. That is what happens usually. So in that system got some malicious hacker with a malicious intent hacked the system. Recently we heard that, no? It was a big news about RCC recently. The whole data was leaked. So then, is it possible to re-identify and trace the person or the identity of the person in that data set? Yes, it is possible. Now coming to pediatric ophthalmology, whatever the risks are there in the online world and cyber world is very, very complex. These data we are going to, whether it is an amblyopia prediction or a skin correction, we are taking the pictures of the kids and uploading them. So this carries a lot of complexities among regarding consent, and the risk is long lasting. It's not an immediate risk. So we will be discussing some of the key ethical challenges. There are so many, but we will be focusing on a few. So as I already told, AI in ophthalmic images are not just images. They are actually identifiers. Iris scan, we all are familiar with, no? Iris is an already established biometric identifier. And retinal vasculature is increasingly identified as a unique feature, and that as another identifier. This is there in our Aadhaar, we know that, no? So data protection and privacy confidentiality issues are very much when we are using AI in your practice. So data protection strategies should be there whenever you are using an AI assisted machine. So this can range from encrypting the messages, encrypting the images, to restricting access to the data. And there are technological advancements like federated learning and DL, DP, etc., which are helpful in privacy protection. So privacy is a major concern. Coming next to the bias, just like in the literature bias, the clinical application can also have bias. How come that? Because already we know that AI work on the data that is already given to that. No, it learns from the data provided to the machine. And then when you give a new image, it is analyzing with the whatever learned information and then giving you the report. So if the data set that is given to the machine itself is lacking some representation of certain ethnicities, race, or age differences, or whatever. So then the machine is not familiar with the data. So just imagine a data set, a machine that is trained with a data set from Western population, and you are buying the machine, and you are using it for your population. So we know that there are a lot of differences, racial differences in eye structures, the anatomy, iris structures, the blonde retina and the pigmented retina, everything looks different, no? So when this is adapted into our population, you should have an internal validation or a third party validation that has to be there. And also, whenever you are buying a new machine with an AI supported system, you should make sure that the data set is representative. It is not trained in a single institution, but it should be a multi-centric and a diverse population, and including the rare diseases, and in all age groups, depending on whatever the purpose of the machine is. So regular auditing is also important, because if you are giving you only all those diabetic retinopathy pictures through a hazy media, then over a period of time it can drift, and then AI can make mistakes. So the third important point is, as in the previous speakers told, you ask a question or you give a prompt, it will give you an answer. But how that answer was reached, it is not told by the AI machine. So why it happened, nobody knows. So this is lack of transparency, and it can impact the trust, and accuracy of the machine can be wrong. So this has been improved by explainable AI, which will tell you that because of these findings, it is diabetic retinopathy, the stage, and all those things. So when it is an explainable AI, then the trust is much, transparency is better, and also trust will be better. So go for an explainable AI. They are a little bit advanced, but then that has to be there. And the fourth important point is that who is responsible. In the first case, the person missed the glaucoma, the AI machine missed the diagnosis of glaucoma, and it advanced. Who is accountable? Is it the doctor who made wrote the diagnosis, or is the software developer who made the AI, or is it the manufacturer who made the machine, or is it the institution which bought the machine? Who is responsible? Actually, there are no clear guidelines. So this is this called a shared responsibility. That is the answer the AI gives, and the sharing is not even. It depends on what kind of error and in which stage the error happened. Recently, while I was preparing this, there was a usage policy that is given, that is announced by the ChatGPT. They have said that whenever you are using AI services for financial, legal, or clinical application, there should be human oversight, and they are not accountable for that. But then that is for an individual's use. When you buy a machine like with a very costly one, with AI privileges and all, then that makes a mistake. Who is accountable? It is not that clear. Now, access and equity, we are going to divide with the advancement of technology, and always will divide or widen the rural-urban divide, but that is more of a societal problem, and we clinicians are not in a position to control it. So when you see the whole picture, there are a lot of ambiguities, ethical and operational, and so we need to have regulations and restrictions which will be a responsibility of all stakeholders involved, not just one doctors or the ones who are creating it, but all other policymakers also should be involved. So India is not lagging behind. They have come, this is also very recent. This act has been there for a long time, from 2023, Digital Personal Data Protection Act. But the DPDP rules has been introduced on November 13th. This gives you rights over your data. That means from now onwards, hospitals has to ask what do you want to do with the data, whether you can share it, whether we can use it for. So maybe you have to have an additional informed consent. This is going to going to be implemented in 18 months, over a period of 18 months. That is what the rule says. But then in this AI, 18 days are making a lot of difference. So 18 months, I don't know what all things will change. And they have also asked private agencies to appoint data protection officers and consent managers in your system for the oversight of AI use. Now, coming to the responsible integration, it should always be used as an assistant. It's a very powerful assistant, but it is never a decision-making or an autonomous body. And whenever you are purchasing equipments, you make sure that it is trained in diverse population with data sets and locally validated, and transparency is assured. And maybe just like our hospitals having infection control committee, we talk about sterilization, all sterile precautions and all, but still we do have infection control committees. Maybe we need to have AI oversight committees, because even though you say that you have to cross-check it, many may not be doing and you may end up in problems. So the human touch, the AI is not the only reason why we are losing a human touch. So I'm not going to comment on that. Road ahead is that we all, actually we ophthalmologists or any doctors, we are all healthcare professionals and we are not technology experts. So we have to update our knowledge awareness on AI use, and we should remain updated because it's evolving in such a rapid phase, and it is going to encroach into almost all areas. And human judgment should never be underrated. Future directions, we don't know how, when our hospitals are going to look like with all these robots controlling the doctors standing behind and robots giving the instructions in front. Maybe, I don't know when. So whether ethics and the decisions can keep pace with that kind of a fast moving world, I don't know. So we ourselves have to have our own ethical boundaries. That is what I can recommend. Thank you. Any questions or lunch?
Thank you, ma'am, for talking about the ethical aspects of the whole thing and the medical legal aspect. So we have to be very careful when using AI. So the thanks for the warning, ma'am.
Yeah, it has to be. Because it's very easy and it's a shortcut, no? So everybody will be attracted to it because it gives you so convincing reports. Everything will be so precise, and the language is so impressive. So maybe you will get carried away, no? But you have to be very aware, no? That's it.